All right, good evening, everyone, or afternoon. I'm equally as confused as Deborah. Good afternoon, everyone. Welcome to our work session on the Child Care Initiative. I'm just going to make a quick announcement and confirm our colleague Eric Gutschall is with us on the phone. Eric, are you there?
I'm here.
Excellent. Okay, I'll try to remember to keep an eye on my email and otherwise pause for any opportunities you might want to take to jump in. So we are just delighted to be here. I have a couple of opening remarks before we turn it over to our staff to talk about the Child Care Initiative and a series of materials they'll be presenting to us today about the next steps for this major work effort, which has already been underway. So just to frame us all and what got us here, we took action with adoption not of the fiscal 19 budget that we somewhat recently completed, but back with the fiscal 18 budget. Adding a full-time employee to the Department of Community Planning, Housing and Development, who is now with us today, as well as giving the manager direction to develop and to bring to the board a work plan to address the issues of childcare in Arlington County. At that time, certainly at least anecdotally, and based on examples of cost, we believed that this issue was a big challenge for Arlington families and for Arlington employers, including Arlington County government. And now, as a result of some really hard work that's been done and will be presented to us today, we know that this is a tremendous problem, that we have a known child care capacity that is greatly exceeded by our under 5 population. We know that costs are perhaps even worse than we thought they might have been when we directed this body of work. And so there is a lot of urgency to meet this challenge facing our community. Thankfully, there is a lot that Arlington County can do, and we have a group of providers, of businesses, of representatives from agencies all across county government and the public schools that have been working together to bring to us today a series of strategies clustered around the role that county government can play in providing information, in addressing obstacles that drive up cost and reduce supply of childcare, in workforce development, increased participation in existing subsidies, and a whole variety of other strategies. I am so appreciative of their work to date, and I just wanted to suggest that I think they'll be presenting to us some of the examples of what the work group has accomplished so far, how many hours they've put in, but they have expended hundreds of hours to get us to the point that we're at today already, and they've also created what I would really describe as, I think, a model for civic engagement in Arlington County, starting with the January outreach that I think many of us attended, an effort to reach out to truly diverse populations across the county. This has also been an effort, I think, to really focus on the big picture of an issue facing families, and to get us as a community understanding and following the need to tackle that big issue before we get into the weeds of some of the code changes, zoning ordinance amendments, or other more technical partnerships. So in both the efforts to reach a more diverse population and in the efforts to shape that conversation about a big issue, I think this has been an exemplary public process so far. So wanted to commend our staff, and on that note, turn things over to the county manager who will be introducing the team talking to us today.
Thank you, Madam Chair. First, I actually wanted to give a thanks to you because you have, while you're chairing the county board, still given an incredible amount of your time to work with the task force, and I think it's been very, very helpful for us to have that guidance. So as I mentioned to you before we came in here, Anita Friedman can't be with us today. She's with her mother. But we have Deborah Warren and Caitlin Hutchison and Kim Vaca are here with other staff. So I'm going to turn it over to Deborah.
Okay. Well, thank you, Mark, and thank you, Katie. I really appreciate, your leadership, as Mark said, on this issue. It's highlighting its importance to families in Arlington and also to the community at large. We know this is a very deeply personal issue that affects the young people in our population. And I recall sitting here with the budget process, my colleague Ruben Varghese talking about the population diamond and how the majority of Arlingtonians are between 21 and 45 childbearing years. And this is a really significant issue for that population and also for our economic development. And I do also want to acknowledge Michelle. I want to thank you and Anita, who's of course not here, for your leadership and your support, and also yours and Anita's willingness to roll up your sleeves and really help with some of the nitty-gritty problems that, as we have been working on this big picture, some of the challenges have arisen, and I really, really appreciate that. This is a substantial team effort. I am going to be doing the presentation with the support of my colleagues, but you can see here, this is the team, and I just want to acknowledge them because the participation, the cross-cutting collaboration and integrative work has been phenomenal, and I think that's why we are where we are now. So this is Caitlin Hutchinson from DHS, Kim Vaca, who's our new full-time planner from CPHD, her supervisor Jennifer Smith, another Jennifer Penny from DPR, Kim Baldini from DPR, Erica Gibson, who's our child care supervisor and expert on all things child care, David Remick, who's our executive director for Alexandria Arlington Workforce Council, and Michael Dahmer-Irwin, who's our quality assurance manager at DHS, and Brian Vickers, who's a management analyst. And they have done a phenomenal amount of work with regard to our data study, our risk and reach study, which formed the basis of our action plan, which we'll be talking about in just a minute. Katie, you framed why we are here. We're going to just touch on that very briefly. Of course, it was the 18 budget guidance, the adopted guidance suggesting that we develop an amended work plan, and I would say that we have accomplished that mission. What I feel particularly enthusiastic about today is that we have an actionable strategy, or set of strategies for moving forward. It's complex, multi-layered work. I do want to let you know we're going to be laying out what we plan to accomplish by when, but it is a phased approach, multi-layered approach. Some things lay on each other and are dependent on each other, but our goal is that 5 years from now, we will be able to say that all Arlington County families have access to high-quality, affordable childcare. That's our vision. And we are developing performance metrics to see how we're going to achieve that mission, and that'll be part of the work going forward. So we began this work in earnest exactly a year ago last summer. We had a meeting at the end of July and set about to develop a framework for action. And early on, we decided that beyond just looking at child care programs, child care centers, ultimately, we want to work towards an integrated child care system that goes beyond child care. But, and I know that's a hairy, ambitious goal, but it's linked to the efforts that we're talking about. And our priority focus is on the vulnerable populations, because we know that in order for the county to be successful, all populations in our county need to be successful, and that early care and education is a really important first step in that direction. I have to say that I was really stunned in our risk and reach study by the data point that 1 out of every 5 children in Arlington is poor. And it's a very affluent county, but we really have to look at those pockets of poverty. And that's why we did a study by zip code, so that we could really see where the areas of vulnerability are, as well as where the resources are and aren't. So moving forward with regard to the data, this is just one slide of, we're not showing it, 84 slides that we have in our risk and reach study. They are available on our website, but you can see that while the population of Arlington is growing by more than 10%, as evidenced by this data over a 4-year period, and this is data from 3 years ago, the population of children under 5 is growing exponentially. And in fact, when you drill down into specific zip codes, some zip codes are skyrocketing in terms of the percentage of children under 5, and we have more granular information about that. Next slide. So, as Katie was indicating, the child care capacity We inventoried the capacity. Now, when we talk about childcare, we're talking about childcare programs. We're talking about childcare centers. We're talking about family childcare. We're talking about cooperative childcare. We're talking about family day out. This study did not encompass nannies. And what else did we not cover? That was pretty much it, yeah. But when we really drilled down, we identified less than 7,000 slots for 13,406 children under the age of 5. Now, we know that some families don't need childcare. Some families, it may not be in their culture to utilize childcare. Some families utilize other family members. But that said, we know that we have a significant gap between the supply of childcare opportunities and what the needs are. This is just one slide of many that we have that we selected so that we could show you the differential by zip code. And I'll just highlight a couple of things. The blue bars are the total number of children under 5, again by zip code, and the green is the known child care capacity as of a few months ago, about 6 months ago. The salmon color is the percentage, the number of slots that are subsidy slots and current child care subsidy slots. So you can see that zip code 22204, it has the highest number of children and the greatest percentage of need. And that said, the only zip code, just as a quick glance, the only zip code that really matches, well, there's two, that match the capacity and the need are 22209, 22202. But there's just significant need also in 22207 and 22202. Is that right? Yeah. So Arlington, this is national data here on this slide, just to be clear. This is an early care and education project that looked at national data. 70% of parents with children under the age of 5 are employed, and of those, 14% are single parents. And when you look at Arlington, when you look at where people work, I think it's 70% of parents, no, 80% of Arlington parents who work commute out of Arlington, and they have an average of a 30-minute commute. So they're going to need childcare for an extended day, right? From early morning, there needs to be some transition time. Let's say it's a standard 8-hour day, then they need another, period of time to transition and get home. So that can add up to a 10-hour day of need for childcare. Another significant reason why we're here and why this is absolutely critical in Arlington County is that quality childcare makes a substantial difference in school readiness. And this is why APS is a significant partner with us, and of course they have invested in childcare as well. But the difference, this bar shows about a 20% increase in KPALS, which is a kindergarten readiness assessment tool in terms of English. But what this chart does not show is that the difference when you're not in child care and you have limited English proficiency or come from a vulnerable group, low income, there can be a significant difference in terms of school readiness that is mitigated by being in a quality child care program. And we have slides that show that in our Risk and Reach study. And if you think about it in terms of the value of equity, which is one of the primary values in our child care initiative, we need to do more to ensure that we reach those populations and that, that they have the opportunity for a quality early care and education experience. Costs. This slide to me is spectacular. This slide is, you know, if this were the only reason for us to have this initiative, it's a significant reason. We were gobsmacked to really understand. We knew that the cost of childcare in Arlington was really high, but when we compared it to our neighbors, DC, Alexandria, and Fairfax County, we were really, really surprised. And why is that? Well, the cost of rent, the need, you know, the supply, the demand. I think there's a lot of factors for that, but we have to figure out a way to address that, and particularly, again, for those that are maybe above the subsidy level, but absolutely cannot afford childcare. So, as you know, an Arlington family, the median salary for an Arlington family is $108,706. This sounds like a lot of money, but if you have an infant and a 4-year-old, it's going to take up almost 40% of your income. So when you couple that with the high cost of housing in Arlington, it really means that childcare, that can have a real impact on making a decision about having a second child. It can make an impact on whether or not you want to work in Arlington. And we did take a look. We actually have a heat map of the number of people who come to Arlington to work, and I believe it was 108,000 people come to Arlington. Many people like to have childcare near where they work, especially after 9/11, so they can get to their kids quickly. So that's another reason why we need to really focus in on expanding childcare opportunities and making childcare affordable. Okay, we're going to watch a video. I wanted to tell you about this video. We had as part of our significant community engagement strategy, we had an event in January 25th, a community conversation about the needs, and these are some clips of videos that we took that day. Okay, we're going to have to move on, but let me tell you, it's a great video, and it's online at our website. All right, so we already said our vision is that all Arlington County families have access to high quality, affordable childcare, and we will get to our strategies for how we're going to get there. And our mission is, as I said, inclusive, integrated childcare system that effectively serves all families with a priority focus on the vulnerable, strengthened by engagement, participation, and collaboration across a diverse network of stakeholders. And I think that you'll see as we go forward who some of those key stakeholders are. These are the values that our initiative developed, and I'm not going to go through them because you can read them, but advocacy, equity as the first and foremost, advocacy, collaboration, and that's been the true joy of this opportunity. Quality, that the young children are entitled to a safe, high-quality experience in line with local, state, and national guidelines, research, best evidence-based practices, data-driven practices. Culturally sensitive, because we know that the community is significantly diverse, and ongoing engagement through the life cycle of this project. So how did we develop our action plan? We we took the budget guidance at face value, and we divided the work into, we drilled it down to these 3 buckets: accessibility, which does include affordability, availability, and also utilization of childcare slots. We learned, for example, in the process of doing our work, that there's no real way to identify what slots might be available where for a parent who's applying for childcare. It's really not a coordinated system, so that's one of our goals, one of our action steps is to work towards that. And quality, and enhancing the safety and the quality of childcare. So the structure of the childcare initiative. We started initially with a group of folks, the team here from DHS, and we've expanded it to our delightful partners with CPHD and DPR and many other folks. 22 individuals were appointed by Mark in the fall. This group, this leadership roundtable, and Katie is our liaison to the board, is meeting quarterly to review progress. And every step of the way, every iteration has been vetted to date by the leadership roundtable. And the work group was assigned by the leadership roundtable and includes over 40 people and meets monthly, is responsible for the work. Now, next slide, please. This body of 60 people will be expanding as we develop sub-work groups to work on detailed objectives in our implementation plan. Okay, and this is just a slide showing the many organizations and stakeholder groups who are actively involved in our work to date. So our deliverables, I've mentioned our risk and reach study, which is, I feel, very comprehensive. We've updated it, and we plan to continue to update it as we get fresh information, as data sources are refreshed, and also as our initiative goes forward. And this risk and reach study will also be a baseline for our performance metrics as we go forward and figure out how do we measure success of each of those 3 buckets. And then our action plan, which I will orient you to very quickly. Our action plan is color-coded in the 3 areas, and each area has action steps underneath, and who are the proposed work group members, and the implementation plan, which we have a slide later, has more detailed sub-objectives that link to those action steps with leads identified and time frames, which we'll talk about briefly. I'm going to share with you a little bit about our engagement. It's been really exciting work, and I really want to thank all the members of the team and others, as well as Bryna Heifer, who really assisted us in kind of fleshing out our engagement plan. So in addition to a community meeting that we had at the Central Library in late January, before that we had a providers meeting, so we got their input. We've been working really hard to engage parents. And we've also are aware that many of the providers speak multiple languages. So we made sure that all of our materials have been translated into the 5 most common languages in addition to English. We had a very vigorous online opportunity for input. And in that process, we received 500 comments, which we then matrixed out in line with the action plan to look at how we needed to amend our action plan. And our action plan was significantly amended as a result of the input from the community. We do plan to, there's incredible stakeholder involvement, but as we go into the fall, we do plan another community meeting around some specific big chunks of the work that have to do with the zoning work, zoning ordinance, as well as the child care codes. So the implementation plan is, as I said, it's very detailed, and we it's very ambitious, I think, but we have to start, we have to have some very clearly established steps for how we're going to get there. And we collectively made decisions about what would be a short-term action step, what would be that we could accomplish by the end of the year. And the end of the year, for a long time it was like 6, 7, 8 months, but now it's now we feel like it's like 3 months away, 4 months away. So there's real urgency, though, to really tackle some of these really tough areas and also to get some early wins in this process. So we have, I believe, 39 sub-objectives that we hope to accomplish by the end of this year. And we plan to do a mid-year report at the end of January to the board so that we can tell you what percentage of those 39 steps did we accomplish, where are we, what's the next chunk that we're going to tackle. And then we've also committed to developing an annual report on progress. If you have any questions about this, it's a little complicated, but I think it was a really good way to chunk out the work. We are moving into, we've already started on a number of activities, and we are going to be moving into more detailed work groups actually tomorrow. We will be rolling out each sub-work group will be developing its own work plan for how they're going to accomplish their sub-objective with, did we say monthly reporting? Quarterly reporting. And then we'll roll that quarterly reporting into our annual report. So I don't know why, but I love this slide. I love those arrows. So this is a summary of the work that we've accomplished to date, and I really feel excited about it because it's a real forward movement. You know, we've moved forward on what we said we were going to move forward on with, again, an iterative process, which occasionally to me has felt, you know, like we're slowing down a little bit, but I think it's been really, really critical, and we're really excited about our next phase of the work. Some of the things that we're currently working on are a child care land use analysis, and our newest member of the team, Kim Vaca, has really done a lot of work on this already. Would you like to just give a brief summary of what's going to be included in that plan and when it will be expected?
Sure. Thank you. So the action plan includes an action step for staff to review the general land use plan, the zoning ordinance, and the development review process in order to identify obstacles or barriers to childcare, and then to propose modifications to these land use policies to eliminate or alleviate these barriers. So the risk and reach study that was developed by DHS does a really great comprehensive analysis of the demographics and the childcare population and the quality of childcare in Arlington. It is a good basis for the study, but we didn't really have a comprehensive understanding of how childcare and land use are relating in Arlington today. So this childcare land use report focuses specifically on the land use issues and how they relate to childcare, and will include the childcare survey that we administered back in May to our center-based programs and the results of that survey. It will go over the land use issues and how they relate to childcare. We'll go over the history of state and local licensure processes and amendments to these license regulations. And we'll include how the general land use plan, the zoning ordinance, and the development review process operates today in Arlington. And then it will provide examples of how other jurisdictions, both locally in the DMV area and then nationwide, how they regulate childcare. And maybe some suggestions or recommendations for staff moving forward.
And that work will form the basis of some of the efforts as we look at the zoning ordinance in the fall. Another big chunk of the work will be looking at our local child care codes, which are named Chapter 16, 52, and 59. And I know that was looked at a couple of years ago, but it's a fresh start. And we are looking at the state regulations. Let me pause myself for a minute and say that Arlington is the only locality in the state of Virginia that regulates child care centers in addition to the state. So we're looking at the state regulations in parallel with our regulations. It's confusing to providers. It makes it's another part of the challenging process if you are a person who wants to open a child care program. So we are taking a look at that, and our plan is to have a redlined version to the board this fall, by the end of the calendar year. There are a lot of opportunities for advocacy, and there's a chunk of our action plan, various places in our action plan which refer to advocacy. But some of the partners in our child care initiative are including the Partnership for Children, Youth, and Families, is advocating for some changes to the VDSS, or Virginia Department of Social Services subsidy program. There's a desire for increased subsidy funding, a Northern Virginia differential, which I think is really necessary, and more funding for professional development, as well as more funding for providers to participate in something called QRIS, or Virginia Quality. It takes time. You know, if you have a provider participate in training, you have to have a substitute. I mean, it takes money because you can't leave the children, you know, and you know, it's a really complicated process. So finding ways to provide the quality development that we want our providers to have to care for our children is critical. There's many conversations going on right now. I feel like we have some kind of child care meeting every day with some group or other, but one of the exciting opportunities that we've seen is partnering with seniors to do some multi-generational kind of creative model programs. And there turns out there's one right in Fairfax. Do you want to say a little bit about the model that you identified in Lewinsville?
Sure. Currently, there's a development underway in McLean, and they are redeveloping some existing programs. I think on site there had been a couple of child care programs and a senior center, as well as an adult day center. But in partnership with Wesley Housing, they are developing a number of affordable units for older adults that'll be affordable at 50 and 30% AMI. And in addition to the new housing, there will also continue to be the adult day program and the senior center, but they'll both have increased capacity. And then there will also continue to be the child care. There will be about 200 slots, and then some fields as well. And so they'll all be co-located, and the development is redesigning so that it's more integrated and there's more opportunities for intergenerational engagement. So that's something that we've come to know about recently, and would love to have conversations about, you know, thinking about here.
Yeah, so we're going to do a site visit later, actually, I think this week. Another opportunity that I just found out about in another example is in our now competitor, Alexandria. The Campagna Center, a nonprofit which really focuses on care for children, and has the Head Start contract in Alexandria, has partnered with AHC to develop affordable housing and a child care facility on the west side of Alexandria where the needs are. And I'm going to go take a look at that program because I think that's another opportunity for us to take a look at. We are developing another exciting part of this sort of collective impact work is working collaboratively across county agencies to really map out how do you, if you're a provider and you want to open a child care facility, let's say on Columbia Pike, how do you go about doing that? Who do you talk to first? What do you need? What steps do you take? So this group is working very hard on a how-to guide and it's also an opportunity to map out what is and identify what do we need to change? How can we streamline this process? Because it really is pretty complicated. So we want to figure out how we can make it as easy as possible. So the two big chunks that I know people are very interested in are the review of the zoning ordinance and This is a tentative timeline that we think is aggressive, but aspirational maybe. Do you want to say a little bit about that, Jennifer? No, we're good? Okay. She does not want to say. Everybody knows that there's a significant public engagement piece that's required as a part of this. There are lots of key stakeholders that need to be involved and processes that need to go through. But if all went smoothly, our plan is to have another big community meeting in September, get to that zoning committee in October, do the what is it called? Request for advertisement, thank you, in November, and then do the Planning Commission and then come to you all in December. So that's one of our green strategies by the end of the calendar year. That would be a substantial deliverable if we can get that to happen. And similarly, the review of the local child care codes, as I said, we are going to leverage this community meeting, and like we did last time, we're going to do it collaboratively with all the county agencies as well as our private partners and other key stakeholders. Okay. All right. So there's a lot in those 39 action steps, but I just wanted to highlight a couple of pointers. I think it's really helpful to look at what are other jurisdictions doing to address this problem, because this is a national problem. And Mark forwarded an article that was in the Washington Post yesterday about strategies that they developed in World War II. And we're Arlington. We know we can address this problem. But there are some folks who, believe it or not, are ahead of us in certain areas. And one area is providing some financial assistance for families who don't meet the state subsidy ceiling, which is 185% of the federal poverty limit. There are lots and lots of folks who need to get a boost in order to do that. Alexandria, for many, many years, has a scholarship for fours, and DC has something called First Step. They're investing a lot of money. DC actually has universal pre-K for 4-year-olds now. So there's a lot to look at with our local jurisdictions. Montgomery County also has an interesting child care, what is it, a child care land use plan? Child care in public spaces that we want to take a look at in some detail. Arlington County's VPI programs are in some other areas, they're mixed delivery systems. We don't have that in Arlington, so we want to take a look at that. And by that,
Give us that acronym is the Virginia Preschool Initiative.
The Virginia Preschool Initiative. And by that I mean school providing classrooms as well as nonprofit partners. One of the significant things that really arose in our research and listening at our various community opportunities is the unmet needs of childcare for children with disabilities and or behavioral health needs. There are some really strapped parents in Arlington, and we really need to provide the support that they need in order to be able to work and also to intervene early with those children. Non-traditional hours and drop-in childcare. If you look at where people work, and we have a slide in our Risk and Reach study that shows what kinds of work Arlington County residents do, there are a number of Arlington County residents who do things like service work. So, working in restaurants, for example. They need non-traditional childcare. People who are applying for jobs or going to school need drop-in hours. What if your child is sick and you absolutely have to do a presentation at work? What do you do? And some companies have, I know your husband's company has an opportunity for drop-in for ill kids. So we want to look at those kinds of opportunities here in Arlington. We do have a web portal, but we want to update it to make it mobile friendly, and we want to have it be inclusive for all stakeholders. And we really want to get to the place, as I mentioned earlier, where we can have a real-time way of identifying where there's an available slot and a way that parents can figure out what they are really eligible for. And that's complicated work, but I would love to see us get there like in a year. There's a lot of work to be done with landlords. We just put together frequently asked questions for landlords who have a lot of tenants who are providing childcare, and to help them understand why it's beneficial for the community to have, you know, childcare within those residences, and what some of the sort of guidelines are, liability questions, all of that. And we will be posting those on our website shortly. Child care workers do not make a livable wage here in Arlington. And I think the average salary for a child care provider is like $26,000 a year. And 90% of folks in Arlington make more than that. And if you think about it, you think about what long hours they work, how stressful it is, the limited opportunity for breaks, even eating healthy foods. That's an issue we need to look at. You really don't want somebody who's wicked stressed to be caring for your infant, you know? So we need to figure out how to support our child care providers in all kinds of ways, and that's one of them. Lots of work to be done on quality and training, and developing sort of a protocol for the inspection process. Right now, Arlington County provides 2 inspections a year, correct? And then the state does 1. That's a lot of inspections. So we might want to take a look at how we can streamline that process. So going forward, we are going to develop a communication plan for the next phase of our work. Hi, Bryna. We're going to ask Bryna for some help on that. And also a performance measurement plan so that we can really benchmark successes as we go. And we're going to continue, DHS and DPR and CPHD continue to provide backbone support to this initiative. And we will provide you with regular updates. And as I said, we will provide you with a fuller report at the end of January, and then an annual report a year from now and thereafter. And we'll be updating our website, which is CCI. We have our video is ready. Could we play that before we move to questions? Maybe we could start at the beginning.
We made hundreds of dollars in non-refundable deposits at various places to try and ensure that we could get that one place would take us. And we were fortunate enough before he was born, unlike some people I know, to find out that we could get a slot.
I've been happy with the child care services in Arlington. My daughter did co-op for about 18 months. She started at 18 months and went to 3 years old. And we got in okay. I know it's pretty competitive to get in, but we were really happy doing that.
I'm a resident of Pentagon City. I have a 2-year-old child. We were very happy to find child care that was within walking distance of our apartment.
Hi, my name is Mark Schwartz, and I am the county manager in Arlington. And one of the experiences I wanted to share is the challenge we have in recruiting and retaining employees who have young kids. Number 1 or number 2 issue that comes up is we need more opportunities to find daycare for our kids in Arlington. They would prefer to have it in Arlington so that they could come to work here, drop their kids off, get to see them during the day. And it's been made very clear to me, if we're able to increase the number of slots we have for kids, that's going to help us attract and retain some of the great employees we have here in Arlington County.
I've been in early childhood for 15 years, and I'm a super strong believer in the benefits of high-quality early childhood education. And we know from years of research that children who experience high quality have better outcomes later in life. They graduate high school more often, they have savings accounts, they're older when when they have their first children, they go on to college at higher rates. So I'm a super firm believer in this, and I feel like in order to sustain a system that makes all of this happen, we need to really invest in our early childhood providers and in the programs that serve the young children in our communities.
My biggest concern is the justice for the child care workers. I don't know how much my child care workers are paid. I'm concerned about asking. I don't know if I want to know the answer, and I want to make sure that we're doing things we can that, yes, I would like to be able to have a cheaper child care payment. I'm more concerned with making sure that the women who are taking care of my son every day are appropriately compensated and supported.
Given the expense of child care in Arlington, I worry about long-term how it will affect the broader socioeconomic diversity of this area, how we'll be able to keep and retain talent in Arlington, given some of the potentially prohibitive costs associated with daycare.
Montessori is very important to our family, and we want both kids to have the Montessori education. So we applied to Arlington County Montessori, all 3 schools that we were allowed to apply to. But we didn't get in the first pick. We were all put on the wait list, so we had to go to one of the private schools in Arlington. So she's now enrolled in Arlington Montessori House. But the timing didn't really work out with us. So Arlington Montessori House and all the other ones, to my knowledge, require you to put in a deposit around January to secure your spot for next September. But the lottery for the Arlington Montessori, the public Montessori, isn't until April. So if we definitely 100% wanted her, which we do want her in Montessori, we had to go with the private one, which is Arlington Montessori House, and they required a pretty large deposit. It was over $1,000 to secure her spot. So then she started, and then in October we got a call from Boston Hoffman saying that we got off the wait list for that, but we decided not to take it because we would have lost close to $1,700 that we had already paid, so that was not an option for us. I mean, I'm really interested still in Arlington Montessori. I wish that the timelines were changed to be more in line with the private ones, so that if you don't get in, you still have the option to get in the public one.
Big thanks to Katie Crystal and to the broader Arlington community for the work they're doing around this action plan, and I'm just happy and eager to see more work done around increasing accessibility and quality and affordability for childcare.
I don't know about that Mark Schwartz character in the video, but thank you so much, Deborah, and to the team, Caitlin and Kim, for being here to answer questions. We have a recommendation here from the manager, right? A recommendation that we act to.
I am the Chief Judge of the Arlington Circuit Court, serving Arlington.
Hello. A recommendation to accept this action plan, consistent with sort of bookending our direction from fiscal year 2018 budget guidance. I believe we also have an opportunity to give thoughts or sort of further informal guidance about what we'd like to see in terms of status reports and future check-ins. So that's where we're eventually driving towards before we end our work session. But let me start well before we get there with just an opportunity for questions from colleagues about the work, the efforts to date, some of the big bodies of work that will be coming before us later in the year, and other questions perhaps about the risk and reach study. Mr. Dorsey.
Thank you, Madam Chair, and let me just congratulate and thank everybody for doing this incredibly important work. And because it's important, I certainly want us to succeed to the greatest extent possible. And for me, that means trying to figure out exactly how to prioritize what we're trying to solve. And the data collection that you've done thus far is impressive, but I'd like to see about the opportunities to do more, because there are a few things that are just not quite jibing for me. One, we're using our assessment of the need based on the mismatch between known slots and slots that are available as segmented by zip codes. But as you acknowledged, 80% of Arlingtonians commute out of the county to work. Many people want to have childcare close to where they work. You mentioned the non-traditional arrangements, or not non-traditional, but the alternatives where people have other family caregivers, they have au pairs, they have nannies. Can we get at any greater granularity of exactly what it is we're trying to solve so that we can focus like a laser as opposed to just generally looking at this as a supply and demand issue?
Yes, we can take a look at that. I'm not exactly sure how we would go about doing that. It might be something that would have to be a survey of parents, maybe a, I don't know what the word is, selected
Random sample.
random sample by zip code or something like that. So we'd actually have to do some interviewing, I think, to really figure out exactly what the need is.
I mean, I, as one board member, would encourage us, you know, within cost reason, certainly, but I really think this is too critical to just sort of just do stuff and hope that it works. I really think we need to figure out, the goals are so ambitious, how to actually marry opportunities for people, try and get at affordability. And if we do the wrong things or do the things that are not necessarily drivers, we're not going to succeed. So to the extent that we can use some survey tools, we can analyze wait lists, we can really drill down with existing providers to find out what are some of the issues. I would be supportive of that. In addition to just identifying what is exactly the need, of course, like you, gobsmacked at the cost differential in Arlington compared to other places. And I don't really understand why that would be. Why we would be more expensive than DC. I can't imagine that our rents are higher for commercial space. At this point, it's all speculation. Is it regulatory? Is it just the big child care center providers just driving up costs disproportionately? I don't know, but I think we need to know what the answers are to that.
And supply and demand. You know, that could be part of that factor too. One of the things that we're doing for the first time this year, to your point, is it's part of the resident satisfaction survey that never rolls off my tongue easily. We're including a series of questions that actually drill down into exactly what you said. You know, do you need childcare? Where is your greatest need before 6 a.m. or before 7 a.m. after 6 p.m.? Which I think will give us a statistically valid to the degree that, you know, that goes to all county residents. I think that will be a starting point for some of that. And then we do have a great, just as Mark referenced in the video, not here, with the county workforce. It's a great sample set of what people are looking for. We know that so many of our employees don't just live in Arlington; they work in other places, or they live in other places. And so there's a great body of folks we can access there to drill down on exactly some of those things with alternative work schedules. As you know, there's a big chunk of our workforce who do not work in Courthouse Plaza and do not work 9 to 5. They work different shift hours and things like that. So there's a lot of opportunity there. Now, that's not representative of the entire county, but it's a start.
And Mr. Dorsey, if I may, I'd love to have staff speak to a little bit of the work to survey providers, because while you're absolutely right that we don't have a great sense of the granularity of demand, you were suggesting too, we may not have as much of a sense of the obstacles to the expansion of supply. And that is an area where we've done some work about.
No, not so much about the expansion of supply, the cost, the reasons why we have such a cost differential.
Got it. Okay. But I do think, I don't know if it's certainly the issue of rent I know came up in the provider survey, but to the extent there's anything you could characterize from those provider survey responses about what their biggest pain points are to staying in business, to expanding the number of slots they offer, or to creating more slots.
So we surveyed 74 center-based programs, basically everyone who's not in a family daycare home. We've received almost to date a 50% response rate, so we're still going out and advocating for more responses, but so these metrics may change. But we'll be putting these results in the land use report, but preliminarily, the biggest obstacles for expanding child care centers would be finding a space with adequate number of parking spaces, finding or reserving an outdoor play area, and then finding a space with adequate square footage. Those are the top 3 responses that we've received so far.
And do we have any sense with parking requirements, with square footage requirements, access to outdoor space, are we substantively different than the District of Columbia, for example, in ways that would place more cost on the providers and therefore parents who are seeking childcare? And if you don't know now, you can certainly get back to me
I don't
later.
know the answer relative to the district. I do know that in the state of Virginia, the requirements for space are 35 square foot internal space and 75 feet external space per child. Yeah, which is the same as ours.
All right, so we're not adding anything more in terms of
Not-
space
not
than
in terms
anybody
of the
else?
space, but
Okay.
yeah,
Parking,
parking is a big issue.
yeah.
I think our requirement is that there be one parking spot for each employee. And then, of course, you need parent drop-off, pickup, and that can be, a barrier.
Right.
Looking around to see if
I think Arlington, compared to Virginia, is a very unique circumstance, right? We're more dense than a lot of other jurisdictions. We are more compact, so we have more problems, space constraint problems, and that plays into outdoor play space because our commercial corridors are more built out, more dense than, say, places out in Loudoun County that have more room available for these more open sites for childcare.
But that said, DC and Alexandria are dense too, so we need to take a look at that and see what the difference is there.
Would it be fair, I don't know, Mr. Durst, if you would mind, I would be interested in seeing, as we talk about potentially seeing zoning ordinance amendments later in the year, hopefully one of the things we will be considering, or a couple of the things are those very issues. Is it fair to expect that we might, as an opportunity to discuss those zoning ordinance amendments, be able to see some comparative data about what the district and Alexandria require?
Yes, so part of this land use report is focusing on exactly what you're requesting. We'll be putting in our best practices section, a discussion about how other jurisdictions handle parking and how they regulate parking. There are a variety of different standards that are used across the board. And so we'll be showing other examples and then showing how we regulate parking. And we'll be using this research to guide our recommendation to you and modifications moving forward. Parking is something that we're looking at addressing by the end of this year because that was a barrier that was identified repeatedly through the community engagement process, from staff to the residents to the providers.
And Madam Chair, if I can just get one more in before we go to colleagues. So in the supplemental deck, slide number 65, and this is speaking to the issue that Ms. Cowan was raising earlier, just about overall market forces, supply and demand. And this is, I guess for those, I don't know if we can pull this up.
We can.
Great.
That's it, no childcare.
So for this one, I mean, it's kind of fascinating results, just looking at the key number that's informing our supply-demand conundrum and just looking at the range in the area and nationally. Is there a particular best practice that we should be targeting as an ultimate outcome? I imagine we'll never get to where Falls Church is in having way too much supply.
That's something?
Should maybe figure out how our neighbor might be able to help us in our challenge. But beyond that, I mean, looking at the reason I was so interested in the district, because it would seem that the district has just as much, if not more, supply demand pressures, yet we're more expensive, which just seems to be quite troubling. I'm wondering I'm not interested in Arlington exceptionalism when it comes to this. So. But is there a particular number that's a best practice? Should we be aiming for 60%, 70%?
I think that staff, in putting together the data in this risk and reach study, the reason that this slide is here is because there is not an agreed upon best practice. And one thing I was wondering is the Washington, D.C. 38% excluding portions of the 0 to 5 because they're going to universal pre-K. So it's 38% of, but you don't have to provide the slots to those 4 and 5-year-olds because they're going to pre-K. So we're using the same metrics as we would across the other jurisdictions, but 38% is not as big of a problem for them because a big chunk of that 0 to 5 is being served elsewhere.
And we should have put an asterisk on that. I'm sorry about that.
We can make that.
Yeah, we should make that change.
Yeah, a couple of, so do we know what's going on with Falls Church?
Who are they serving? Where are those kids coming from? Why do they have so much childcare? Is it expensive? What's happening?
I can tell you that a number of our subsidy recipients actually go outside of Arlington and are served in Falls Church because providers are more likely to accept the subsidy there. And, you know, they have an easier time finding a slot.
So maybe looking at Falls Church a little bit as a model as whatever they're doing that we're, I mean, that, anyway, I assume you'll be doing that, but that
Yes.
seems like a very fruitful area of inquiry, if you will. You've done a lot of survey, and thank you. I mean, this is great. We've taken a, you know, we've come a long way. We've obviously got a long way to go. But how much did you involve the business community? Did you survey the business community? So, you know, our manager is real aware of what's going on with his employees. Did you talk to the various small, medium, and large businesses? I see head nods.
Well, we have really, we have David Remick here, who's with our workforce development. Can you respond to that?
Hey, David, you can well, there we go.
We reached out to businesses for anecdotal information. We haven't done a full-blown survey to businesses as the Child Care Initiative Group. I know that Arlington Economic Development has done a survey a few years back and about what are the needs of businesses moving into or continue to move into Arlington. And childcare was, accessibility and availability of childcare was of the top 5. And so, you know, it's something that we need to look back into. I do want to just quickly point out when we talk about the expense of why is childcare more expensive in Arlington. You know, Deborah talked about the salaries, and we know with any business, personnel costs are a majority of the cost of any businesses. In the Greater Washington region as a whole, the average salary for a child care worker is $28,000, a little over $28,000. In Arlington, it's over $29,000. Part of that is because Arlington child care facilities are having a hard time finding talent. And if you look at, you know, there's a lot of good quality aspects of being a child care worker, but stressful. Many of the child care workers that are working today hold 2 jobs, potentially more, and they go into retail, which is a transferable job, making around the same wage. And so we are seeing that there are opportunities to address the income of the child care workers so that they can stay, hopefully with a 1 job versus 2, but also stay away from transferring out into a retail sector that has many more opportunities and are less stressed.
Thank you. A few other questions. Thank you, David. So on the business, it seems to me that, you know, one of the self-interested reasons we're interested is we want to keep our talent here, right? And childcare is a huge part of that. The business community has a tremendous interest in making that happen too. And I feel like this is one of there are a number of these kinds of issues where they're kind of like not here. And yet they're the ones that need this probably almost more than any of, I mean, the business community, to me, they should be at this table. They should be really interested. They should be part of the solution. They need to be understanding the problem. And as in a number of cases, they're not here, and we need them to be here. And I'm not sure how to go about doing that. And you know, we can't just wave a magic wand. But that's something that I think we need to be thinking about and maybe talking about more with our business leaders. Because if we're going to solve this problem, it is at basis economic. And we are not going to, I don't believe, you know, it's going to come out that you see what we pay child care workers. I mean, it's ridiculous. You know, Mr. Remick, you weren't ridiculous, but what we pay child care workers is just ridiculous. So there's some major changes that happen, and if we don't have the business community as part of this, I doubt we're going to be able to do that lift. So that's just what I'm kind of putting that out as a big idea, if you will, not something that I'm even sure how to address. Mr. Manager, do you have something you'd like to say?
You know, on that, I think that we intend, and I don't know if it's specifically laid out on the work plan, to go to the Economic Development Commission as soon as we're done here and you've accepted this body of work, and then work closely with the bids as an initial step. I think we probably also should reach out to the Chamber of Commerce. I don't know if that's on our list, but
that's on our list.
Yeah. So there's a list that's been developed. I just don't, you know, I've looked at all the material. I know it's in there somewhere, but your emphasis on this point, I think, is incredibly important.
Yeah, thank you very much. Well, I'm the liaison, and I'm actually having coffee tomorrow with the leadership of the Economic Development Commission, so I'll prepare the groundwork for you. Thank you. I had one other just question about when you were making your presentation, you were talking about the surveys, which were great, and you said the action plan significantly was amended significantly as a result of input. How? What was the input that you got that caused you to change things, and how did you change it?
We have so many iterations of the action plan.
If it's too hard an answer, oh, yeah.
Stack like this.
Also the matrix, though, of comments. And
Yes.
The matrix has not been completely finalized at this point because right up until June, when the leadership roundtable last met, we were making some final tweaks to the action plan. But we do have a matrix of all of the comments that were received. They're sorted by action step and what they most relate to. And we indicate either a response if there's a question in the comment, and then also an indication as to where any changes to the action plan might have been made as a result of that comment.
Thank you.
So that will be posted in the very near future. It's just there's a few more tweaks following the June Leadership Roundtable meeting.
Thank you. And then maybe another way to ask that question. So everybody was gobsmacked about the price differential, and that. So what else? Is there anything else that really surprised you in the information you got back in?
A lot. A lot that surprised me. I'm new to Arlington. I've been here a year, and so for me, really learning about the pockets of poverty and the vulnerability and how quality preschool can mitigate those kinds of factors. I knew that, and I knew that from earlier work, but you could see it in the metrics here in Arlington. And just to make the link to future success, if you have a quality preschool opportunity, you're much more likely to pass your SOLs in 3rd grade, which puts you on a track for high school graduation, et cetera, et cetera. So, I mean, it's huge.
It is. Well, thank you. And I'll just put in a quick comment. So when I was on the school board, we knew that, and we did we expanded as much as we could for our vulnerable population, and that adds to the cost of our education here in Arlington, and a thanks to the board in the former years that approved those budgets and our citizens who are willing to do it, because it really is worthwhile, but it does cost money. Thank you. Thanks.
Mr. Weistad and Mr. Gutschall, I know you're on the phone, so we'll go to you next.
Thank you, Madam Chair. So I do want to thank our chair. This is really a holistic, resourceful, and inventive study, Ms. Crystal, and I appreciate your leadership, as well as that of staff. And I think what's exciting about the people in the room here today is we have people from, DPR, Parks and Recreation, Human Services, CPHD, our planning folks, and our economic development folks, and that's what it's going to take, is a really coordinated and holistic approach to this. So just a couple, the other thing I want to say is it wasn't terribly long ago that we had the same issue in our household, and at alternate times we utilized a family daycare center in the neighborhood. We used a church-based daycare center, and then we also used a downtown kind of urban office building type setting. So depending on person's situation, work patterns, and so forth, any one of those things could work at any one point in time. But Mr. Dorsey opened up an interesting line of question regarding a little more granularity in the data, which I think would really be helpful. And what I'm wondering is how much of this we're going to be able to do crosstabs on. So for example, slide 6, which talks about why are we here, breaking down this information by zip code, under 5, capacity, and so forth. Are we going to be able to also look at this in terms of, for example, where the families currently work and obtain their daycare? So as Mr. Dorsey says, and as we know in our 2018 economic profile, where we have that little map and it talks about where Arlington residents commute to on a daily basis, and there's arrows to Prince George's and the district and so forth. And at the same time, there are people who come into Arlington to work.
Right.
And so if one of the findings of the study is that people would most prefer daycare close to their jobs, how is that screened for in this data? And you don't have to say any more about that now, but I think that's really good that we've coaxed that question out. The other thing that I'm wondering, and this is also bigger than we can get to today, but if you want to give any sort of thought perspective on this, is how are we going to be approaching what we do to facilitate availability and accessibility depending on the setting? In other words, at the family daycare level, what are we thinking about at the family daycare level to increase those, to increase these, accessibility and availability? What are we doing at the church level, at the care center level, and with respect to the orange lines, the metro corridors, the blue, orange, and yellow lines? How is what we're going to be doing dependent on where the child is? And I guess the other question is, the parent just wants good daycare for their son or daughter or their charge. And so how, if at all, do our quality standards differ depending on the setting? And is there a reason why we would want to have more flexibility, with lower number providers than higher number providers? I mean, how does the size inform our decision making with respect to quality of care as well?
Oh, the size of the number of children served?
Right.
Yes.
Right. And the setting. Right.
And the setting.
Right.
I'll just address real quickly the availability component of your question and comment. We'll be looking from CPHD's perspective across the board at all types of childcare programs, from center-based to family-based programs. For example, this year, one of our short-term items is to look at the zoning ordinance and address family daycare homes and their process for review through the county's processes. Right now, we require family daycare homes with 6 to 9 children to apply for a use permit that goes to the county board for review. The action plan asks staff to look at whether we should be moving from a use permit process to more of a by right process. And if we do, what would that look like? And what would the impacts of that change be? So by facilitating family daycare homes through a by right process, less time, less review, less cost for providers to move forward with their own family daycare home. So that would encourage and hopefully increase family daycare homes in Arlington County if that were the process.
Yeah, that's a helpful question. Thanks. Lots of policy questions going forward.
Lots of policy questions.
Thank you.
You'll be seeing a lot of us.
Oh, well, and Ms. Hutchinson, I just, when you made that comment about intergenerational care, I love seeing you talk about babies and infants and children when we were just together a week ago talking about seniors.
The full life cycle.
She's quite talented. She's quite talented.
Mr. Gutschall, who's been patiently on the phone, did you have any questions or comments you wanted to raise?
I will very quickly just associate myself with some of the comments already made, but the only thing I could think of to add is first of all, this is certainly a very ambitious initiative, and so I'm hesitant to layer on even more, but nonetheless, I think I'll circle back on what Ms. Garvey had talked about in the role of the business community, because as an employer in the community, I can certainly let you know that the availability of child care is something that is very important, I'm sure, to all employers, big and small. So it shouldn't be underestimated, the value of quality, affordable child care. And to that end, I think it's not just the Economic Development Commission and the Chamber. I hope we are also including the bids and property owners. I think when we look at how do we incentivize and fill our vacant office space, I think we should understand that the availability of child care can be part of that equation. And so we ought to sort of expand the conversation and take this great work that we've already done here and build on it and really integrate it, I think, into our overall economic competitiveness picture.
Mm-hmm. Thank you.
Oh, yes, we actually have an example of an opportunity that we took advantage of to meet with an interested developer. Do you want to share?
That's fantastic. And I think...
Sorry, go ahead.
Just to further the thought, where I'm going with it is that where we have, parts of the county where with the highest vacancy rates, if we could look for opportunities in some of the ground floors of those buildings, and whether or not that can't plug into the zoning look that we're looking at, I think part of that scope, if it's possible to look at site plan condition language, especially some of our older site plans that were highly prescriptive in terms of use, and maybe making it an easier pathway for if a building owner would need to come in for a site plan amendment, make it sort of broadcast that there's a where possible an easier path to that. I just think that there's a lot that we could do, but also respecting that this is a very ambitious initiative and appreciate where it's headed.
So I think Ms. Hutchinson had a comment about a recent conversation with a property developer, and then we can maybe go to Ms. Vaca with thoughts on Eric, or Mr. Gutschall, your points about the site plan conditions in the scope of the land use analysis.
I was just going to say that I think, we had a recent meeting with a developer who was interested in putting childcare in a ground floor retail space on Columbia Pike. And while we may not have gotten to the point where, it's a go yet, the conversations have been very helpful because they're giving us perspective that we don't necessarily have. And then in addition to that particular developer, we've been working with a number of affordable housing developers too, to figure out, not only what can we do to make it easier to have childcare within existing complexes, but what can we do to make sure that they're incorporated in plans moving forward. So, that's another partner that I think has been very interested and involved in the work group and leadership roundtable.
And one of the things that we're trying to do differently is to all come together. So with this meeting with the developer, we had multiple county agencies come together to try to, figure out how we can create a circle to make the process a little easier. And that's where we came up with the idea of developing this how-to guide.
One thing I'd like to add relevant to that question and comment, the action plan right now includes a action step that states to examine Arlington's land use policies and regulations and explore opportunities to incentivize establishment of childcare facilities where and when possible and committed affordable housing and commercial development. So that's something that we're definitely will be considering. One of those tools will be looking at bonus density and using childcare as an incentive to facilitate more density in developments. I don't know if you want to add anything.
I think it's important to note that as you look across all of these, we will be undertaking a scoping effort. So while we were scoping out what we could accomplish, at least from our part, from a zoning perspective earlier this year, we will be coming back and we'll be prepared to talk with the board as part of those check-ins. What do we think is included, like in the action step that Kim just discussed? And I think part of what Mr. Gutschall has alluded to, we have that awareness and it's something we're planning to do, but we would always have an opportunity to check in as we develop our scope and report back with the manager and touch base with the board at those points.
Thank you. Mr. Gutschall, did you have anything you wanted to add?
No, just thank you very much. Appreciate it.
Thanks. Mr. Dorsey.
I'm willing to wait for you. You haven't had your round yet.
Please go ahead and I'll figure out if I have any remaining questions.
So love the section where you looked at educational outcomes that are realized by children in care, and was wondering if we had any, again, looking at seeing if we can get any additional gleanings from the data to determine whether or not the kindergarten readiness assessments for both reading and math, whether or not we had data from APS that looked at children who were in family daycare homes versus child care centers to see if there was any differentiation.
We don't have that data.
Okay.
We'll have to ask that.
So we should take it up with the schools to maybe see if they can suss that out?
They did quite a report about, oh, gosh, now, 10 years ago, yes, so they've done that, yeah.
But I want to add that other jurisdictions do collect that by type of program, and that's something that, like, I've had recent conversations with the Partnership for Children, Youth, and Families. It's something that they've talked about and would like to recommend moving forward.
Terrific, terrific, because I think part of our goal here is not just about numbers and supply, it's about increasing quality across the board, and if we can figure out whether it's in homes or in centers or vice versa, that there are some really good things that are leading to good outcomes, we would want to make sure we create a community where that stuff can be shared and learned. So thank you for looking into that.
I just want to add that as part of our action plan, we really want to boost our efforts to increase quality, not just for center programs, but also for family day providers as well. And we've actually started that work. We've had a number of activities for those family providers to get education. We did a big thing on a Saturday because that's the best time for them because they're not working.
And it was really interesting, just, if you look through the slides, and I just glanced at them, but some of the issues that we talk about at the elementary school level, school age level with achievement gaps, those seem to be far reduced by the traditional boxes that we measure when it comes to readiness for kindergarten based on access to childcare. So, I mean, this is a hugely important thing, which sort of leads to an overall comment, but really is a question to see whether or not we have the capacity to at least consider this. This initiative, again, thank you, Katie and everybody else involved, hugely important, and I love your vision. I love where we're going with this. But if we're going to get to the point where we're going to increase quality, which I presume we're going to measure with ratings or accreditation, we're going to improve the living standards for people who work in the childcare industry, raise their wages. These are things that are going to be upward drivers of cost for childcare. And while we have some ideas in terms of easing regulatory burdens, perhaps parking is an issue, perhaps we achieve it through some bonus density and land use, those will not necessarily lead to downward pressure on childcare costs unless we do something with supply. So to speak to that, are there ways in which we've looked at other places where the government has combined with the business community and public-private partnerships to bring dramatic new differences in supply relatively quickly? Because some of the things we've talked about today will take years to work their way to the system, and it's unclear as to how they will affect market. However, I would imagine if there were a substantial amount of childcare slots which came online relatively quickly, we'd have an ability to affect quality and supply at the same time and maybe moderate the cost. So is that something we're planning on looking at, exploring in any way?
As part of the land use report in the best practices section, I'll be including a wide variety of ways that counties and cities have looked to increase the quality, affordability, and availability of childcare, mostly from a regulatory perspective. Some of these things, however, don't necessarily translate to Virginia or to Arlington, but they are just things to keep in mind. For example, one of the things that the City of San Francisco, City and County of San Francisco has done is including impact fees. So for all residential and commercial development of a certain scale, they require that they either pay a certain percentage of money to support childcare in their county, or that they actually provide childcare on site or nearby. And that's a thing that is a pretty immediate result, because once they go through the development review process, it's included in their project. But like I said, that doesn't necessarily translate over. But there'll be other examples like that that might translate over that we can discuss in this report. But this will be from a land use perspective and not necessarily from the services perspective.
Thank you, Ms. Vaca. Mr. Schwartz, to the extent possible, I'd love for you to give some thought, and I won't put you on the spot for a response today, but maybe there's an economic development component that can complement Ms. Vaca's work in terms of looking at other jurisdictions which have tried to bring more supply online really quickly, and what that looks like, whether we've had any success stories that we could seek to crib from.
Before I go to Mr. Weissat, Mr. C, I just wanted to comment. I think what you've identified is one of the fundamental tensions of this work, right? And we've thought about, I don't want to think of quality and affordability as being in tension with one another. And I think the Child Care Initiative Leadership Group has done a really nice job, along with the implementation team, of trying to understand how those things are complementary. But I would suggest part of what I think we heard from a lot of providers who attended that January meeting, who participated in online public comment, is that to the extent there is a little bit of a pendulum that swings between affordability and quality, that Arlington has been, that pendulum maybe has swung too far. The fact that, exactly as Ms. Warren said, that we are the only jurisdiction in the state that has separate regulations from what the Commonwealth requires, part of a very well-intentioned effort to ensure the highest quality possible setting for our youngest residents, has potentially tipped us away from affordability. We've talked to and heard from a number of providers who have told us point blank that Arlington's regulatory environment drove them to set up shop in another jurisdiction. So I think you're absolutely right to raise the question that you're raising at scale. And the other sort of fundamental tension that I don't think we can or will be able to resolve, that I know the entire nation is grappling with, is how do you pay these folks who work in such critical jobs a living wage and make childcare affordable for the consumer. I think that'll continue to be a genuine struggle. But that piece, that relationship between quality and affordability, I'm glad you surfaced that. And I think when we talk potentially about some code changes in the beginning, when it reaches the board in Q1 of 2019, that is a policy decision for us to make as the Arlington County Board. And I think it's going to be a real discussion we have about trade-offs. Mr. Weissat.
Thank you. So this is kind of a lead into, or maybe a takeout to what Mr. Dorsey and Ms. Crystal were just talking about, and that is when you go to the implementation plan, very helpful chart. Love how it's all laid out and color coded. So at AV2 availability, Romanet 7. Provide information and resources, i.e. toolkit, to assist child care programs with opening and maintaining a child care business. So we've got, AED has a phenomenally vigorous biz launch program. And so how are we coordinating with the biz launch folks in terms of giving prospective daycare providers the kind of the tutorial and information they need to launch a business and then help sustain that business? How are we doing in assisting them in coping with the paperwork? And to Ms. Crystal's point about regulatory compliance and the fine line in terms of what the purpose of the regulatory item is. Does it really add value and quality? Or is it something that might be done in a more streamlined, simple, less regular, or more user-friendly fashion without impairing care quality and without negatively impacting cost?
Yeah, that work has already begun on that toolkit. Those are the very questions that we are looking at. What is unnecessary? What is going to, we obviously want to ensure that we have, the highest standard of quality, but, we want to make sure that we haven't set up barriers to providers opening childcare programs in Arlington. So that work has already been started.
And we have the core team here, CPHD, DPR, and DHS, but AED has had a very prominent role in what we've done to date and has been involved in conversations around the toolkit and processes, and as well as some of the workforce conversations. And I think Kim might want to talk a little bit about the toolkit.
Yeah, so we started back when I started in February, looking at what the process is for childcare facilities and programs to go from the very beginning when they talk with DHS through CPHD and all the other many various departments to the end when they actually obtain their license to operate. And we had realized that there's many steps and many agencies that these programs and providers have to go through, but there hasn't been a one-stop department or website or page or document that helps them navigate the process. Each department has our own section of this big puzzle, and we outline that section, but they're so interrelated that it's confusing for a lot of the providers to understand how they navigate. And so what our goal is for this how-to guide will be for all providers from center-based to family-based programs to understand who they go to, what the process is, what the permits or applications are, and then the supplementary documents they need to provide, the cost of and time associated with each permit and process in one spot, so that we can give them a document and say, here's how you navigate this program from opening your business to expanding your business to maintaining your business through inspections and licensing and the building department or ISD, and then closing their business if they do choose to do so. And so we would be here to help them through that, but that has involved AED extensively for their programs as well. So this will be a multifaceted departmental approach.
So Ms. Vaca, that sounds terrific. And so when you mentioned the word close, so have we thought about, or do we ever do an exit interview when somebody shuts down their business, they terminate their business, they tell the parents, you know, sorry, we're closing. Do we follow up and say, is it because of regulation? Is it because of attracting quality assistance and care providers? Is it parking issues? What is it? And how might that inform our decisions going forward?
From CPHD's perspective, we only know about closing when we come forward for use permit reviews, and we contact the provider and they say we have not opened our business, and so we revoke the use permit because it's no longer functioning or never was functioning. But you can speak. Sure.
Hello. So there is actually no exit interview, but once our office, DHS office, is notified that a provider or center-based program wants to close, we do ask for them, number one, if their license is still active, to submit their original copy of their license to us so that they're not operating illegally. And then we do ask for a reason. So the majority of the reasons are that they're either relocating out of the area or they are retiring. So we haven't had any issues in terms of capacity or any land use issues or anything of that nature.
Okay, so Ms. Gibson, right?
Yes.
That's good to hear then. So you're not, at least at the moment, hearing of reasons that might be fixable.
No, not at all. And we are, well, I actually am tracking that information internally on a spreadsheet. And like I say, that's how I know that the majority are either they have relocated out of the local jurisdiction to another state, or they've either relocated to like Fairfax County or Prince William County, or that they have retired. We've had some recent providers that have retired. We are faced now with one that is contemplating shifting from providing family home care to looking for a full-time employment because the enrollment has dropped. So those are some of the things that we're facing with. So that's the first time that I've faced the issue since I've been in this position, but it definitely hasn't been any other barriers that, you know, we can't readily resolve.
Okay, and then is there anything that we're doing or that we could do to help find child care slots for those families who are losing that care when a business is shut down and they're given notice for this?
So usually we have been facing some situations where some of our programs have been faced with fires, and we've had to relocate other programs. So what we typically do is we reach out to some of the local areas. We usually try to group them by zip code, and we will contact some of the local child care programs within that vicinity to see if they have availability, and then we will work with them to relocate all of those families.
Okay, that's good to hear. Thanks very much.
Other questions or comments or any further thoughts that we have about what we might like to see in terms of future reports and mid-year or annual check-ins? So for my part, I think just to give some thoughts on that direction piece, appreciate the plan to do a kind of interim check-in. I believe you mentioned in January about how the objectives are accomplished. I would say for me, the thing I am most interested in is ensuring that we can track the outcomes. And I think Mr. Dorsey gave some good examples about the level of granularity that we need in order to really make sure that we're making progress. There is so much good work happening, and so the question becomes, how do we make sure that we're moving from outputs to outcomes? I have no doubt in my mind that we are going to achieve every output on our list. The team is so talented and so hardworking, and I think that. But the real question will be: are we actually moving the ball? Helping. We hope eventually generate sufficient supply that it starts to bring down price, meeting the needs of our highest need families, as Ms. Warren suggested. So, the efficacies of the tools and achieving the outcomes over time, I think, will be an area of greatest interest. Just to recap, I think some of what I heard from colleagues is that there is an interest as we go forward to get more analysis of what I might say the demand side. A lot of what we have is about the supply. We know with some granularity what the supply is, where it is, et cetera. But I think there was some real interest about knowing where families are seeking childcare, whether that's in Arlington, and if so, where in Arlington, or is it closer to their work when they work outside the county, and when and which hours especially, and whether that can be achieved perhaps through the satisfaction survey, so through some of the questions that are being asked, random samples, engagement of the business community to learn what they know from their employees. I think that I heard some real interest from a number of us in that regard. And then as Ms. Garvey and Mr. Gutschall both noted, I think you heard some real interest in growing the role of the business community. And I might seek to put a finer point on that, seeing if we can start to identify for some asks for major employers in the county. What is it that we'd like them to do besides just sort of in a general sense coming to the table? Are we interested in having them work with us on expansion of a subsidy program like DC has to meet the folks who are falling in that gap, for example? Are we interested in using them as partners in gathering data? Are we interested in using them in some of these land use conversations, right? I think having employers as tenants in conversations with property owners or developers could be a really potentially useful partner in terms of advocating the needs. So as this work goes forward, identifying the roles for the business community, the asks for the business community, employers, and potentially even looking to integrate childcare into our economic development framework, which lives, I think, right now with our EDC as well as AED. If I've missed anything, I'm just looking around for any final closing comments. Mr. Gutschall, if you wanted to add anything else, please do it. I want to make sure I'm not leaving you out.
I think you summarized well. I think as you were speaking, the only finer point that I can think of is it is, to me, an interesting juxtaposition between what can we ask of the business community and then what can we work to help. When I was speaking to the notion of how we fill some vacant office space, it's also that I think that there are barriers that we are working to remove that they should be aware of that we're working on and how they might partner. So I think it's just making sure that we're talking about, yes, there might be things that we want to ask of them, but there's also things that we have to offer. So that we're keeping it very collaborative in spirit, and along that line, recognizing that it's one thing, and I think it's rightfully so that the main reason, the gist behind this initiative is to meet the child care needs of Arlington County residents. But I don't think that we should lose sight of that we should in some way be thinking about folks that work here that may not live in the county and who want to have daycare options that are near their place of employment, because I think that speaks to the whole attractiveness of Arlington County as a location for employers.
It's such a good point, Mr. Gutschall. I agree very much. And I think that actually does circle back to the other point that Mr. Dorsey made so well about really as we try to understand the demand, right? That it's helpful to have because I think it clarifies the point, but the imperfect nature of our statistic about the ratio of slots to kids under 5 in our community. So where we look at, for example, 22202 is one of our only 2 zip codes where the capacity gets close to or approximates the kids under 5, but exactly as Mr. Gutschall was just alluding, that is a, kind of a major employment hub. So, are our numbers capturing or failing to capture that whole driver of the demand side that are folks who don't live in Arlington, but who are part of a competitive workforce that will in turn help us address our commercial vacancy problem because they come to work here. So I think that's a great point. Thank you for raising it. All right, so I'm not going to make a formal motion, but we do generally want to see sort of head nods or comfort with the board to accept the action plan. Much of this work has been underway. I think it's important that we give it our stamp of approval, and we know that the hardworking staff and different partners are doing so with the board's knowledge of what they're doing and our support for it. So
I think we should add a new category of gloriously accepting it. I mean, this is an impressive body of work. I mean, accepting just seems so de minimis.
That's a good point. Absolutely. I love that. So yes. I don't know where that falls in the taxonomy of our formal board. Unfortunately, our county attorney is not here to let us know what the regulatory implications are of embracing. Yeah, right. But I love it. So I think there we go. Can we add embrace? We agree. Ms. Garvey, did you want to make any concluding comments?
No. I was thinking we could accept with pleasure, but I think embrace sounds great.
All right. Well, thank you all again for the great work. I know we'll see members of this team, as Ms. Warren said, often. Yes. Certainly later in the year, beginning of Q1 2019, and I know, really looking forward to that land use study, which will be a great opportunity to start to get more specific about some of the tools that we'll have before us. Any concluding thoughts from you or from staff?
I'm just so lucky to have this opportunity to work with this amazing team and this amazing community, and thank you all for your really just such thoughtful questions. It helps us focus our work and move to another level, and I really, really appreciate that. Excellent. Including Mr. Gutschall.
Thank you. All right. Well, with that, we will adjourn, and thank you all again. Enjoy your evening.